Welcome friends. Revise with me homeopathic remedy Glonoin. This is part 2B, clinical application in brief, and the text is taken up from Allen's keynote and K.N. Mathur. This is good for BHMS students and interns. I am Dr. V.K. Chauhan, homeopathic physician. So let us start. Glonoin is a specific remedy for following conditions. Number 1 is epilepsy or a violent pulsating headache, worse in warm room before the fit, followed by unconsciousness. Face is pale and bright red by turns. Throbbings of heartbeat felt all over the body, especially the head. Glonoin 6 every half hourly when pulsations are felt in head before the fit, and Glonoin 30 3 hourly after the fit till feels normal. The text comes from Dr. K.N. Mathur. Vertigo. With pulsating pain in head, with flushing of face, intoxicated feeling and fainting. Vertigo caused by the shaking of head, worse from stooping. Text is from K.N. Mathur. Headache from heat of sun or working under gaslight, menstrual climacteric from acute congestion of head. The sensation is bursting, throbbing, pulsating, holds head with both hands, worse from lying down after profuse uterine hemorrhage in place of menses, worse from jar and stooping. Migraine. Text comes from K.N. Mathur. Exophthalmic goiter. With carotid pulsations or violent pulsation, with bursting headache, with rush of blood to face. Hot flushes of menopause. Hot flushes that are sudden, violent, and with an upward rush of blood to the head. Palpitations in the chest are also common. Bursting headache rising from the neck with great throbbing and sense of expansion as if the head would burst, cannot bear the least jar. Text again comes from the K.N. Mathur. Heat stroke. Heat stroke or sunstroke happens when the body can no longer maintain a temperature of at least under 105 Fahrenheit when exposed to hot weather. High-risk features include hot and humid environment, extreme physical activity, much of clothes, poor oral intake of fluids, accidentally leaving the child in car. Mechanism of symptoms produced are with very hot and humid environment, the natural cooling mechanism of body fails, leading to buildup of heat into a dangerous level. For heat stroke, please remember it is a medical emergency. The first thing is call for the ambulance and remove the patient to the hospital as early as possible. Meanwhile, undertake the following: Remove patient to a nearest cool place if possible in AC room. Remove all the clothing and sponge the body with cold water. If ice is available, put ice wrapped in a towel all over the body. And the specific remedy here comes Glonoin. Let us go to the differential diagnosis of heat stroke versus heat exhaustion. Here we find heat exhaustion. We have dizzy, lightheaded or fainting, confusion and disorientation, headache or vision changes, excessive sweating and thirst, chest discomfort and labored breathing, muscle cramps and abdominal pains, acute nausea and vomiting, weakness or excessive fatigue. The heat stroke symptoms include loss of consciousness, seizure or strange behavior, body temperature is elevated, difficulty in breathing, persistent vomiting, hot, red, dry or moist skin. In heat exhaustion, treatment part includes removal of patient to the nearest cool place if possible in AC, cold shower if possible, allow him to drink water, and homeopathic remedy is gelsemium. And symptoms are like dullness, dizziness, drowsiness, confusion, headache in back of the head, vertigo, heaviness of eyelids, weakness and trembling of the body. Again, this information is coming from K.N. Mathur. Friends, thank you very much for watching and listening. Sharing is caring. Thanks once again.